My name is Dr. Nyjon Eccles, and I'm considered to be one of the UK experts in bioidentical hormone replacement, or body identical hormone replacement, as it's become to be known in recent times. This is a two-part video where I want to address some of the misunderstandings about BHRT and the differences between BHRT and HRT, and some of the common questions that are asked. I'm hoping at the end of these two short videos that a lot of the things that are unclear to people will become much more clear. So without further ado, let me go on to this first slide, which highlights some of the common questions, really. First of all, what is BHRT? What is it? And why should we be talking about it at all? What are the risks and benefits of BHRT compared to HRT? What are the risks of breast cancer with BHRT and how do they differ from HRT? Is it necessary? What's in it for you? Is it safe? That's a very important question. And what is compounded BHRT? That's BHRT that is made up specifically for an individual rather than a standard formula. And is that form of compounded BHRT regulated? These are some of the common questions that are out there that I get asked myself a lot and have to respond to. So let's look at this. First question would be, why would a woman want HRT in the first place? Whether it's HRT in its conventional form or BHRT, this bioidentical form. Well, I believe this slide answers that. These are just on the left, a few of the common symptoms that a woman will suffer during menopause or even perimenopause because of hormone deficiency, because the hormones, particularly estrogen and progesterone, fall. Some of the common symptoms associated with that are on the left. So hot flashes, vaginal dryness, irritability, anxiety, depression, insomnia, which is lack of sleep, of course, fatigue, aches and pains, incontinence, poor short-term memory, brain fog. These are just a few that are on the list. Less commonly known, those on the right are increased risk of Alzheimer's disease, osteoporosis, bone thinning, associated with that spine and hip fractures, loss of teeth, wrinkles and dry skin, cardiovascular diseases, and cancer, breast cancer in particular. So increased risk of those associated with hormonal decline. Well, that's interesting, isn't it? Because if you look at the results of the Women's Health Initiative study, which was published in 2002, this was based on the use of conventional HRT, which was a combination of estrogen with synthetic progesterones. And this is what the study showed. There was significant increased risk of breast cancer, cardiovascular disease, stroke, and venous thromboembolism, which is deep vein thrombosis, clots, in women receiving oral estrogen plus progestin. Now, progestin is a synthetic form of progesterone, and it's important to note this. If we noted these downsides, these negative effects, combination of estrogen, oral estrogen, plus progestin. Now, this publication led to a lot of women taking themselves off HRT because they were very concerned about these long-term side effects. Doctors also were concerned about them and sort of started to restrict the number of years that they were happy to give HRT because of these concerns. What this study did, though, is it propelled a series of investigations to better understand what was going on with these hormones and why they had these increased risks. And what we have discovered from these later studies is that it's very important the way, the type and the form of the hormone that is given. So whether it's in synthetic or whether it's a natural bioidentical in form is very critical to the outcome, as is the way it's given. So the route of administration, oral or transdermal, is critical to the effect that a hormone will have. I'm going to explain that a little bit more in a minute. So the outcome of these recent studies, what we've learned is that the correct use of HRT has become much more apparent. And unfortunately, this has not hit the press in the way that it should do. There's still a lot of confusion, even within the medical fraternity over the difference in effect of these hormones, and it's critical to understand this. So in this first part of this video, and it's a two-part, as I said, I want to look at progesterone, which is one of the two key female hormones that is commonly replaced when a woman is given hormone replacement. So let's look at progesterone and some of the data around that. Now, these numbers that you see in these slides in brackets refer to particular studies, scientific studies, and I'm going to give you the list of those at the end should you want to research this more for yourself. So, under patient satisfaction, first of all, progesterone was found to be associated with greater patient satisfaction and fewer side effects when compared to progestin. And progestin is a synthetic form of progesterone. What about breast cancer risk? Well, progestin is associated with greater risk for breast cancer when it's compared to progesterone. So the synthetic form of progesterone is associated with greater risk of breast cancer than progesterone, the natural form, is itself. Second to that, data suggests that progestin may facilitate the conversion of weaker estrogens into more potent estrogens, with the potential to increase breast cell proliferation and breast cancer risk. Progesterone, on the other hand, has known anti-proliferative effects in breast cancer tissue. So here, some of these more recent studies have shown that as far as breast cancer risk is concerned, progestins are the ones that seem to be troublesome, but not progesterone. What about cardiovascular risk? Well, progestin, but not progesterone, has been shown to significantly reduce HDL levels. Now, HDL is the protective form of cholesterol. Progesterone, but not progestin, reduces thromboxane-induced coronary artery spasms in primate studies. So progestins increase this spasm of the arteries, and we think this is one of the contributory factors to increase risk of heart disease. So here we see, as far as cardiovascular risk is concerned, progesterone is favorable and protective. Progestin seems not to be. What about depression risk? Progestin use is associated with greater incidence of antidepressant use compared to progesterone. Now, this slide shows what we're talking about here. On the left, you see progesterone. That's the natural form that we produce, the bioidentical or body-identical progesterone. And on the right side, you see an example of a progestin. Now, I want you to note how similar this is. The one on the right, by the way, is Provera, or medroxyprogesterone acetate, MPA. You notice how similar those molecules are. Very similar, apart from some of these groups that are substituted at the bottom in red, there you see, and at the top right. Now, progestins are often called progesterone in the media and in scientific papers. And you'll already begin to think, given what I've said to you so far, that that should not be the case. They should be differentiated. And you'd be absolutely right if you're thinking that. So let's go on further. Here you see the slide shows a lot of different progestins. There's many of them that are used. But what I want you to note is at the bottom in blue, progestins can have androgenic, estrogenic, glucocorticoid, and progestational effects. So they can have other effects other than their progesterone effect. And has been part of the problem. So here on this slide, I summarize a comparison of progesterone effects against what we found with MPA or Provera. So we're comparing natural progesterone against a synthetic progesterone or progestin. Progesterone maintains pregnancy. MPA causes birth defects. Improves mood, progesterone, causes depression, MPA. Improves sleep on the progesterone side, whereas MPA, insomnia and irritability. Progesterone is diuretic. MPA leads to fluid retention. No effect on blood sugar with progesterone, whereas MPA raises blood sugar. Progesterone improves lipid profile, whereas MPA worsens lipid profile. No evidence of increased cardiovascular disease with progesterone, whereas with MPA, there's an increased risk of heart attacks. With progesterone, it reduces the estrogenic stimulation of breasts, whereas MPA increases the estrogenic stimulation of breasts. With progesterone, we think there's a prevention of breast cancer. That's what the studies would support. But with synthetic progesterones, what we tend to see is increased risk of breast cancer. So even though I showed you those two molecules are extremely similar in structure, they can have completely different effects in the body. So this assumption that because a molecule is very similar, therefore it must have the same effect is ludicrous. It's not true. A very small change in a molecule can completely change the way that that molecule impacts on your biochemical systems. And that's what the studies support. So here is the list of references that I refer to. Should you wish to look into what I've said further and confirm that what I'm reporting has come from genuine reference. So in summary, in this first part, the popular view that hormones in all forms are dangerous is false. Not all progesterones are created equal. Progestins increase risk of breast cancer when combined with estrogen, but progesterone does not. Progesterone has a breast protective effect. Progesterone has many positive health benefits, whereas progestins tend to have negative health impacts. All evidence suggests that women can have the benefits of bioidentical progesterone without the risks. And that is the key point from this. So let's come back to close this first part off to the questions that we asked at the beginning. And let's see if we shed some light on these. What is and why a BHRT? Well, I think I've explained the difference. Progesterone is a natural form of one of the key female hormones. Progestins are in synthetic forms. Risks and benefits, we've looked at that. We've shown that progesterone tends to have health benefits, whereas progestins seems to be the contrary. With regards to breast cancer risk in particular, progesterone is protective, whereas progestins lead to increased risk. Is it necessary? Well, I showed you at the beginning that symptoms can be particularly intrusive. It would be important if a woman is seeking some form of hormone replacement therapy, that she seeks it in a form that is not going to increase her risk in the long term, and that's very important. And what I've shown you is that if that's in progesterone natural body identical, bioidentical form, it carries less of the risks than the synthetic progestins. What's in it for you? Well, greater safety and having the benefits without the downsides. Now, what is compounded BHRT? And I want to end with this. What's the difference between compounded BHRT and a licensed form of BHRT? There are a few licensed forms of bioidentical hormones, and these are available on prescription through doctors, but you need to ask for them. So that you get, for example, in the UK, we have estrogel, which is estradiol. And in the next video, I'll talk a little bit about estrogen. And then a natural form of progesterone would be utrogestan, which is available. This is natural micronized progesterone. So these are available on prescription. But compounded BHRT is the natural form of the hormones, which are put together according to the individual need and often based on tests of the individual to see what their levels are and to amend that prescription, because it's made according to a doctor's prescription who's skilled in this form of hormone therapy for the individual. So it's not a standard formulation that is available on prescription. It is a formula which is put together for the individual, but based on these natural forms of hormones. Now, there are a lot of people out there in mainstream, may have an axe to grind or a vested interest, who are implying that BHRT is not regulated. But actually, that's not true. In the UK, BHRT has to be manufactured under Regulation 167 of the Human Medicines Regulation, 2012. That's an MHRA regulation. And on top of that, pharmacists who make BHRT have to be certified as compounding pharmacies. They manufacture under good manufacturing practice, or GMP, and also under good compounding practice, GCP. All of the individual hormones that are made are usually made with quality certificates for each of those hormones. Now, the reason I'm mentioning these is because if you go to a doctor who's prescribing BHRT, you as a patient should ask the doctor if the pharmacist that he uses to compound the BHRT has all of this certification. And if they do, then that should give you confidence that these hormones are being made to a high standard and under the correct regulation. Now, in the US, as far as BHRT is concerned, these are made under Section 503 of the Food, Drug, and Cosmetics Act. And this relates, as I said there, to the compounding of BHRT. So again, this notion that these hormones are made without being regulated is actually false. Now, for those of you who would like more information, more detail, I would direct you to my website, where you will find this article, "Not All Progesterones Are Created Equal." This will go into far more references that I've cited here. This video is really just to give you a very short summary of the status quo, what the differences are between some forms of BHRT, in this case progesterone versus progestins. This article will give you a lot more information, a lot more reference, and a lot more detail, should you want that. And the link is there at the bottom of this slide. So I'm going to close this video now, and in the next video, in part 2, we'll talk more about this subject, but with a bit more emphasis on the estrogen side.